I wanted to take a minute and go over what our new patients can expect over time. I use this chart to go over the road to recovery. So most patients that we see in the beginning, they're in pain and they're suffering. And so that's this area right down in here, the red area. So because of that, our number one goal really is just to get people feeling better. So in the beginning, the adjustments are scheduled close together, and there are 3 possible responses to care. Some patients get real fast results, all the pain goes away right away. A few patients initially take a couple steps backwards before they get better. However, most patients, every adjustment just kind of builds on the one before until at a certain point they turn the corner, they start to notice improvement, they start to feel better, and then their symptoms are gone. So for the majority of the patients that we see when they first start coming in, to go from in pain to out of most pain takes a matter of weeks. Now, at that point, whenever people are feeling better, if you were to actually go back and retake their x-rays, what you would see is the x-rays would look exactly the same. In other words, the person would be feeling better, but there wouldn't have been any structural correction made at that point. And that's why we go on to a maximum correction area. And so even though at a certain point we'll be seeing the patient less often, if you don't go on to fix the problem as much as possible, it ends up coming back again and again and again. So for most patients, to go from in pain to out of pain maybe takes a number of weeks. To go from in pain to out of pain to actually correcting the problem as much as possible, for most patients that takes a matter of months. For some people it can take years. But what is the most important part here? The most important part is maintaining the schedule through all of those different phases. Not only the pain relief part of it, but the correction and then the supportive care after that. So I'm Dr. Jeffrey Schels. I hope you found this to be very informative. Certainly if you have any questions about the road to recovery, what does pain relief look like, what does correction look like, feel free to talk to me or the other doctors at our office. Thanks, have a great day.